Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Shawn Lang. She's Deputy Director of AIDS-CT, or just ACT, right? Is the short acronym. First time on the show. Welcome to the show.
Thanks for having me. I'm happy to be here.
Tell us about the organization. What is it?
So AIDS-CT, on one level, is a new organization, but it was a merger of two long-term AIDS organizations. One, AIDS Project Hartford, which was found in 1985 to begin providing services to people living with HIV and AIDS in the greater Hartford area during the beginning of the epidemic, and the Connecticut AIDS Residents Coalition, which became the Connecticut AIDS Resource Coalition, which began bringing providers together who are responding to the housing crisis among people living with HIV and AIDS. We merged 3 years ago to become AIDS Connecticut, to become a little bit bigger organization and a stronger organization. But the kinds of services that we have to offer folks living with HIV and AIDS, we have a drop-in center where people can get lunch and breakfast 4 days a week. There's also case managers there. We have a med adherence nurse there. We have a nutritionist there. And we can do HIV counseling and testing there as well. And then we have some other case managers that are sited in other places in Hartford, Tolland, and Middlesex counties. We have a full prevention team that runs our syringe exchange program, and we've been doing overdose prevention training with our clients, and they've reversed 53 overdoses in the last year. We also have outreach workers who go out to identify people who haven't been tested yet, to get them tested so they know their status and get them connected to care. We have a TLC, which is transitional linkage to the community. So these are case managers who cover all the prisons in the state, and they go and get connected to folks living with HIV and AIDS 90 days before their discharge.
Men's and women's?
Men's and women's, to begin connecting them to services in the community so that when they come out, that process has already started, so they're not starting from scratch when they're kind of dropped on the street. And then we have a membership services crew, and they focus on developing a resource inventory around employment for folks living with HIV and AIDS. We run a case management training institute, and we oversee a quality assurance review process for AIDS housing programs, and that person focuses on the rest of our members across the state. And then I do I oversee all those programs, but I also do all the public policy work on the state and federal level.
It's amazing, everything that you just described. It's so much more than just simply a place to go if someone discovers that they are HIV positive or have AIDS. There are so many more aspects of it, whether you get out of prison or just are moving, housing, all these different opportunities, organizations, agencies that are, or just resources that are available to someone in this situation.
Yeah, it's really kind of amazing. You know, we have, I didn't even talk about this, but we have a client in housing assistance funds, helps people pay for their medications, other copays, insurance continuation. They get behind in their utilities. We have a short-term housing subsidy that folks can have access to. So all of those things are really important to keep people in care, keep them healthy, manage their disease so that they can just live their lives.
It seems like somebody, everything that could possibly happen that somebody might not have thought of when they were putting all this together, some little thing that may fall through the cracks, they discovered it, and it's been added to the inventory, so to speak, of what is available as far as a resource goes.
Yep. And I think we're lucky, too. We have a bunch of different streams of funding that fund those types of programs, and that's not true everywhere. So, you know, it does what's happening in Hartford area might not be happening in New London, or might be happening on a smaller scale. So we do have a pretty resource-rich array of services for folks, you know, and in partnership with the other AIDS providers in the county as well.
When since you talked about finances, when we hear all the time lately about budget cuts and everything, how are you funded and how does this affect you? And I'm sure it does, right?
It does. We have a lot of different streams of funding. We have some federal dollars. We have AIDS housing dollars called HOPWA, Housing Opportunities for Persons with AIDS. That could pay for first month's rent, arrearage, and a short-term subsidy. We have Ryan White dollars, which are also federal dollars. And those fund our case managers, they fund our TLC program, they fund our another client in housing assistance funds. So those are on the federal side. And then we have state dollars from the Department of Public Health that funds our prevention and syringe services program. We have Department of Housing dollars. that fund some of our other programs. So it's a real mix of things, plus private grants, fundraising that we do. But the budget cuts, there's been pretty flat funding on the federal side. So that doesn't allow us to expand or really enhance services. So we're always trying to maximize what we have. And in fact, one of the things with our client and housing assistance funds that's funded by Ryan White dollars, that's centralized. So what that does is there's one single streamlined process by which those funds get administered, and it cuts down on the overhead. So instead of the City of Hartford funding 10 different programs to do the same thing, they fund one program, it maximizes the amount of money that we can really get back in to help clients.
When you, at the beginning of the show, when you talked about the merger, and you talked about the reasons why, is also part of it financial? Does it make sense to merge?
Sure.
Yeah.
When we came from two strong organizations that had started talking about this probably 5 years before we actually merged, about what a strategic alliance would look like. And in fact, our executive director, John Mers, 10 years ago, we brought our membership together to talk about this, saying, we're not going to see major increases in funding, whether it's on the state side or the federal side. Some private foundations are drying up too and not focusing on HIV and AIDS. They're focusing on other things. We all need to be thinking about strategic alliances, because at some point the funders are going to say, we don't want to fund 100 little fiefdoms. We want to see people pool their resources so that, it gets maximized. So that if there are small cuts or even big cuts, it's not going to be felt as strongly.
You can absorb it a little bit at least.
You can absorb the impact a little bit.
I want to get very basic now with you, and for people who have heard both terms but may not necessarily understand the difference between what HIV means and what AIDS is.
Sure. So HIV is the virus that people contract from an HIV positive person to someone who's not HIV negative. And that can happen through sex, sharing syringes. It's all about body fluids. So there's a lot of nuances in all that too. Many people who get infected with HIV now don't progress to AIDS. If they get tested early on in their disease, get into care, stay on their medication, those medications suppress their viral load, so that even if they had unprotected sex with somebody or shared syringes with somebody, they're almost 0% chance of them passing the disease on to another person. That's why being in care is important. However, there are some people, actually most people, don't get tested early on in their disease. They don't think they're at risk. They don't want to know, whatever the reasons are. But they'll find out that they have HIV, and they'll get an AIDS diagnosis within a year. And an AIDS diagnosis is when your CD4 count or your T cell count falls to 200 or below, or you have two or more common opportunistic infections that impact people with HIV and AIDS that, wouldn't impact us with healthy immune systems at all. So when that happens, it's better to get tested earlier on in your disease, right? You don't want to be playing catch up, because it can be still a very complex disease. One of the things that's impacting globally, but certainly here in Connecticut it plays out, over 50% of folks living with HIV in the state are over the age of 50. And for some of us, over 50, using 50 as a marker might be a little insulting, or people might bristle at that.
You saying I'm old, or something like that?
I just turned 60, so I'm saying I'm old.
Yeah.
But people with HIV, because they have compromised immune systems, even on the medications, and the medications can take a toll on your body as well, but they experience common aging comorbidities like high blood pressure, diabetes, liver disease, renal disease,
The same
dementia.
thing many regular aging people would experience, all the same
Right.
things.
But they experience them 10 or 20 years younger
Okay.
than their non-HIV counterparts. And so that's kind of a nuance that programs that work with people with HIV are seeing, and trying to work with some of the organizations that work with older adults to get folks in there to access some of those services.
Where are we in society today as far as HIV and AIDS go? Is it going down, the numbers? Are they going up? Is there enough awareness?
There's never enough awareness. I mean, it's like with anything. And people often point to the Mothers Against Drunk Driving that have raised awareness. And you can't stop raising awareness. You have to keep up the pace with that. Same with HIV and AIDS. one of the things that we're seeing is folks that are newly infected are young Black and Latino men who have sex with men, so gay and bisexual men. We know kind of realistically and anecdotally that in the Connecticut schools, there's not a mandate to do comprehensive health education, which would include drug and alcohol awareness, which would include comprehensive sexuality education. And particularly, even when there is sex ed, I have a college freshman, a son, and I know when he had sex ed in school, it was very basic, and it was not geared at all, or did not include gay and bisexual kids.
They tried to. I would imagine it would be as politically correct as possible, teaching a health class like that, not wanting to offend anybody.
Well, it's not even about that, but if they're not using evidence-based, age-appropriate health education, it doesn't work.
Yeah, it doesn't make sense for that, for the base you're trying to teach.
Right. They still at least in my son's school, they showed like pictures of advanced, venereal diseases. We know that doesn't work. Kids want real information. And if we sort of move to the outer circle outside of heterosexual kids, and kids today tend to have a much more fluid sense of their sexuality. They bristle at identifying as gay or straight or bisexual. They just are themselves. So I think we really owe them the opportunity to have real information so that when they begin dating, when they make a decision to have sex, they know how to protect themselves and their partners. They know how to have those conversations.
One thing about AIDS as a disease, comparatively speaking with many others, was and is the stigma attached to it. With all the awareness that exists and all the time that has passed that AIDS has been talked about in society, has that stigma gone away a little bit?
Not really. I mean, I think it has.
You know what I'm talking about.
I do, and our folks feel the sting of that stigma from their families and friends when it's still a huge hurdle, huge challenge for somebody to say to somebody else in their life that they've been diagnosed with HIV. Because people still have in the back of their minds, it's 1985, it's a death sentence.
Right, and they're afraid to shake your hand or something
Hug
like
them,
that. Yeah,
kiss them, share a water bottle with them. So we have a great prevention outreach folks who get invited to go to schools, different civic groups, other organizations to talk about all this, to try to help reduce stigma and get rid of those myths that still linger. We're 30 plus years into this, and I've been an AIDS activist for about 30 years at this point in time. So I've kind of seen it all in some ways, but that stigma is still there, and that fear of people living with HIV is still there.
Sometimes that stigma causes people not to be willing to talk about it as much. Good opportunity to take a break now. Is there a website for AIDS-CT for people to go and learn more?
Absolutely. We have a great website. It's www.aids-ct.org.
All right. Sean Lang, Deputy Director for AIDS-CT. We'll take a short break and come right back. I'm Sean Murphy. This is For the Record. Stay right there. Welcome back to For the Record. My guest today is Sean Lang, Deputy Director of AIDS-CT. We've learned a lot in the first segment. Let's just keep going. Let's talk about your background a little bit. First of all, what are the job duties of the Deputy Director, by the way? I would imagine it encompasses quite a bit.
It does encompass quite a bit. So I oversee the directors of prevention and treatment and care, and I oversee our member services programs. So it's really just, I supervise those folks, but the way that we work together, we're teams.
Yeah.
So working really closely
Everybody knows
together.
what they're doing. Yeah.
Yeah, we have an amazing cast of characters on staff. So that's one piece, and I'm really involved in our client and housing assistance funds to make sure that runs smoothly. And then doing the public policy work on the state and federal level. So that means, when the governor's budget comes out, analyzing the budget to see if we're going to be impacted in any ways, and then attending the public hearings, disseminating that information to our membership, There's a piece of legislation that's coming out today. There's a public hearing.
Now, aren't you going to Hartford today after the show, the taping of the show? What's that all about?
Going right back to Hartford. There's a public hearing with the Public Health Committee on an opiate overdose prevention bill.
Boy, that's a whole other show right there, huh?
It sure is.
Yeah.
It sure is. And that's something I've been deeply involved in for the past 3 years. But that legislation is going to require first responders in all municipalities to carry naloxone or Narcan, which brings people out of an overdose and saves lives.
I know we're talking about AIDS CT today, but if you want to touch just briefly on the heroin epidemic that's going on right now, I would be remiss if I didn't ask you about it because you're an expert on it.
So we've been having a Connecticut Overdose Prevention Work Group that's got really broad participation from all the relevant state departments. There are prescribers on that. There's a pharmacist involved in it. There's people that work in treatment programs. That's an open group that anybody can be part of. And the main goals of the group were really to increase awareness about naloxone or Narcan to address opiate overdose, and to increase access to naloxone.
I mean, the police and firefighters and all that,
Police,
and doctors.
family members,
Yeah.
really important. I mean, just in my work, I'd be out at a restaurant, somebody asks me what I do, I get talking about the overdose. Inevitably, somebody has a daughter or son who's in and out of addiction. Where can they access naloxone? I say you can get a prescription from your doctor, but that's a barrier for people because, again, the stigma around opiate use is really intense.
Let's define opiates because it's interesting how many of those things are prescriptions and not heroin in and of itself, but they're actually synthetic forms of it, right?
Yeah, 1 out of 4 new heroin users started with prescription painkillers, whether as recreational use or an actual prescription that they had themselves. So those opiates include, obviously, heroin, morphine, codeine, OxyContin, oxycodone, fentanyl, Vicodin.
All those things you hear about people, and they don't think,
Right.
They would never put that with heroin. They would never associate those two things together.
And I bet at least 9 out of 10 people watching the show have an unused bottle of an opiate sitting in their medicine cabinet.
Yeah.
So we say, find out where the drop box is in your area, at your police station, and bring your unused medications there.
So back to you and your title, basically also included in your many hats that you wear as a PR person, obviously, because you're coming on the shows and do that. But let's go back in time. How did you get to where you are now? Talk about your background a little bit.
So I remember the early 80s being in college. I went to college a little bit later, but reading the first reports of young gay men who were dying, and I was very involved in our gay student group at the time. And nobody then had been sick or died, but it was a scary time because nobody knew what caused it.
AIDS didn't exist
no,
yet,
it was
right?
GRID, gay-related immune deficiency disease. But fast forward, when I moved to Connecticut in '83, and then the mid-'80s got involved in the gay rights movement here, and my first friend came out to me as being HIV positive. And there were no services in the Middletown area for people living with HIV. They had to go to Hartford or New Haven. So again, no funding, nothing, just a collaboration between a bunch of individuals formed the Middlesex County AIDS Buddy Network. So we had support groups. We would pair one-on-one buddies with people living with HIV and AIDS. We did a lot to educate people in the community, and just all on our own time. It was all volunteers at the time. So it was really, comes from a very, very personal place. And over the 30 years of being involved and also being involved in the gay community, I've lost more friends than I can count anymore.
I noticed that people who, when it affects you personally, that's when people are very passionate about what they're doing. They get involved. They try to learn as much as they can about it. And this was the case with you as well.
Absolutely. And, I tell people, I've been at this for 30 years, both on a volunteer basis and then, working in AIDS organizations. But I still get to do what I love to do and work with some really, really amazing people. So I can't see myself stopping at this point.
One thing that we talked about earlier is, if people got tested earlier, the better for them. How do people, if they might be, concerned or not know what direction to turn to start out with, as far as testing goes, what should be the first thing people should do?
Well, again, they can visit our website, aids-ct.org, and look at the services we provide and look at HIV testing. And even if they don't live in our area, we can connect them to places in their area where they can get tested Planned Parenthood all across the state does testing. There's other state-funded counseling and testing sites. Obviously, private physicians. People may or may not feel comfortable going to their physician for a test. STD clinics. So I think, going to places like Planned Parenthood, AIDS service organizations, you're going to not just get a test, but you're going to get some counseling,
Right.
and you're going to get some education. And that's my bias, that's the better
important.
place to go and an important place to go.
Do people's health insurance usually cover all of this stuff or most of this stuff?
If you come to us and other AIDS projects, it's free and confidential testing.
Okay.
But yes, health insurance, since the advent of the Affordable Care Act, HIV testing is covered under preventative care. So the cost of that there should be no cost to that.
How do you see like the progression of research and things like vaccines? How do you think it's going when you look down the road? I hear stories about, for people who can really afford the good stuff, if there's
Right.
such a thing, like athletes, pro athletes. Magic Johnson is one where when you test his blood, you can barely observe any HIV in
Yep.
his blood anymore.
That's true for most of our clients. I mean,
that
that's
right?
the goal in working with folks living with HIV, is to get them into care, get them on the meds, keep them in care, because their viral load's going to be suppressed.
Can it get to the point where it's practically zero?
Yeah.
Oh yeah, is
Yeah,
that right?
sure. And that's where we want people to be, because then they're going to be healthier. They're not going to be, open to these opportunistic infections. And I know in the early days too, it was like, well, he has access to the good stuff. We have a pretty good, it's a precarious system of care. It's a bit like a house of cards or Jenga. You pull the wrong thing
never
out,
know
it's
what
all
could
gonna
collapse.
collapse. But we have a pretty good system of care and pretty good access to care for folks living with HIV, whether they have private insurance or whether they're on disability and rely on Medicaid.
Are there things that exist like in Europe that the FDA hasn't approved or anything like that? You hear stories all the time.
Yeah, there's always new things in the pipeline,
Yeah.
Which is the good news. And the medications that are out now are pretty good. Like, people used to have to take a whole handful of pills multiple times a day with food, not with food. And there's still a little bit of that, but many people just have one pill a day, and it's a triple combination or a double combination. And there's a medication that's been out for a long time to treat HIV called Truvada that folks can take to prevent them from contracting HIV, prevent the transmission of HIV. So if we call them a serodiscordant couple. So if you have HIV, and even if you're virally suppressed, you still don't want to take any chance to pass HIV onto your partner. But I can take Truvada, one pill a day, minimal side effects, if any, and that'll prevent me from contracting HIV.
They say the toughest thing about AIDS is like anytime a disease is cured or treated or anything like that, it's whatever you're putting into you helping your immune system attack the disease. But AIDS is your immune system itself is affected in a negative way, right? Is that how it works?
It is affected, but even if you're diagnosed with AIDS, you can still get into treatment and become virally suppressed.
Okay.
So it's not the death sentence that it was many years ago, not that many years ago, really.
Yeah.
But it's really important, like if there's a takeaway message in all of this, get tested every year, just because. So you know your status, so that if you find out that you're HIV positive, you can get into care. There's medications out there, there's assistance out there, there's support out there.
That's probably
That's
one of the
where
most
we're
important
different
things. Yeah.
than 30 years ago.
And that seems like a great way to end the show. One more time, give out your website for people to go and learn more.
www.aids-ct.org. There's a whole host of services you can access and a lot of information.
Sean Lang, Deputy Director of AIDS CT. We learned a lot today. Thank you for being on the show today.
Thanks so much for having me on the show. It was great.
You can see this show and many others on our YouTube site. Till next time, I'm Sean Murphy. This is For the Record. Take care.